Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, closed angle glaucoma. In the closed angle glaucoma, females are more prone to closed angle glaucoma. So, if you do a female to male ratio, females are around 4 times more commonly affected in closed angle glaucoma than males. Family history is positive in closed angle glaucoma. Now, what are the predisposing or anatomical risk factors of angle closure glaucoma? In angle closure glaucoma, if the patient has hypermetropic eyes and the anterior chamber is shallow, that is, the depth of the anterior chamber is shallow, then obviously there can be closure of the angle resulting in uh, angle closure glaucoma. In hypermetropia, the eye will be small. So even because of this small eye or short eye, there is a shallow anterior chamber, there will be chances of angle closure glaucoma. Iris to lens diaphragm is placed anteriorly. So this is the iris to lens diaphragm. Lens will be here with ciliary zonules and then ciliary muscles. Right. So if this iris to lens diaphragm is displaced anteriorly, so this will result in shallow anterior chamber resulting in angle closure glaucoma. If there is plateau iris configuration or if the lens are large, obviously if the lens are large, then it will push the anteriorly. So the anterior chamber will be shallow. Similarly, if there is small corneal diameter, if this diameter is also less, even then there will be shallow anterior chamber resulting in angle closure glaucoma.
thank you and thank you for watching.